Welcome back to Cox Connections, exclusively on Cox 9 Roanoke. I'm Kim Stanley. Carilion Clinic is one of the largest employers in the Roanoke Valley, and many of you probably visit a doctor affiliated with Carilion Clinic. But did you know the healthcare provider puts millions of dollars back into the community? Here to tell us more are Gary Helton, practice manager for the Carilion Clinic's Pediatric Dental Surgery Clinic, and Marie Webb, senior director of community outreach at Carilion Clinic. Thank you both for coming in today. Good to see you. One of the things that Carilion Clinic does is they put out a benefit statement each year. Why do you do that?
Well, as a not-for-profit organization, we're a community resource entrusted with healthcare funds. And annually, we provide this report to help members of the community understand how these dollars have been spent in the community to provide benefit. As a matter of fact, any excess funds after we've paid all of our expenses stay in the local community, and they're reinvested to improve patient care through advancements in care and in technology, as well as education and research.
Wow, that's great. And then on the benefit statement, I noticed that you put about nearly 155 million back into the community. What does that mean? You talked a little bit about it, but what exactly does that mean to our community?
Well, community benefits the many ways that we support, invest in, and give back to our communities. The $154.9 million is the most recent year we have data on, which is 2009. That's 7 times greater than our tax exemption, which was $22.7 million for the same year. To break it down by services, $129 million, or the majority of the funds, were uncompensated or unpaid patient care. We provide care for all patients regardless of their ability to pay. So as a result, $55 million was for charity care that year. Medicare and Medicaid payments were $46 million less than the cost to provide care. And also the remaining was $27 million in bad debt. We also spent $20.8 million in medical education for health professionals. We have a graduate medical education program that provides accredited residency and fellowship training in more than 12 specialties. We also have support Jefferson College of Health Sciences and the many master's, baccalaureate, and associate degree programs there. $2.8 million was provided in community outreach programs. We actually provided health information to more than 94,500 individuals through more than 1,800 events throughout our service areas and our communities, through mostly health screenings, presentations, as well as health fairs.
Wow, so I mean, we're talking about training, for individuals. We're talking about supplementing what insurance doesn't do, taking care of those who don't have insurance. And then what about contributions, into the community?
Right. We provided about $1.6 million, primarily to our health safety net partners, mostly free clinics, who provide access to medical, dental, and mental health services and medication assistance.
Wow. And then when we talk about the region and what you do in the region, define what the region is.
Well, it's about 1 million people that we serve in western part of Virginia. So it reaches from West Tazewell all the way to Lexington and Giles County, south into Martinsville.
So really just in Virginia, but more specific in Southwest Virginia.
Correct.
What does all this mean to the community?
Basically, if you're sick or you have a health need, you can depend on Carilion Clinic to provide the care you need, whether you can afford it or not.
Wow. Gary, why don't you talk about, specifics around some of the things that you work on and how this impacts the people in this community?
Sure. Part of our giving back to the community is providing these resources. With Carilion Clinic, the focus has really been on specialists, and we have specialists such as our pediatric dentist and our maxillofacial or cleft-lip palate team to service individuals that may have to be sent out of the area if it weren't for Carilion Clinic to UVA, to Charlottesville, or even to Duke to provide those services. We have those here locally, and we're able to see those patients and provide those life-changing services.
Wow, that's great. And most of that you're speaking to, is that located at community?
We have our pediatric dental clinic located at Community Hospital. Our maxillofacial clinic is at our rehab facility. Okay.
How do people, find out about this, or how do they get in touch and take advantage of those services?
Well, our website is a great resource for any and everything, CarilionClinic.org, and from there you can pull up any specialty, even pull up our physicians to see who is the best fit for you and your current need.
That's great. Any other, special areas that really impact the community, such as this, and that people may not be aware of?
We provide a lot of services, and I don't know if Gary wants to provide an example of one of the stories that you might have.
Yeah, I mean, just many different stories kind of go to how we reinvest in this. And a situation that, one of the reasons we built our pediatric clinic to provide that resource is, for one, the lack of resources for our Medicaid population and others that could not find that access on a Friday or at night for that trauma, and they would clog the emergency department. Since building the pediatric dental clinic, we have that resource, and we can take that emergency and deal with them and not be backlogged in the emergency department. An example of this was a lady in southwestern Virginia. She had a huge abscess, and which actually led to her eyeball popping out of her socket. A Lifeguard 10 flight to bring her to Roanoke, and from there, several surgeries. She still lost her eyesight, and including a visit to our dental clinic where we did an extraction for that abscess.
Wow.
Lots of money spent there to bring that to, a little preventative. If we had seen her in our clinic, you're looking at roughly a $145 charge for an extraction, and saving lots of resources and dollars.
Wow, that's a great story, and just one example of many, I'm sure. So,
Definitely.
Carilion Clinic is such an employer. It has such a presence in our community, and what I don't think people will realize is how much they truly do give back to the community. Thank you both for coming on and sharing the stories, talking about all that you do in the community. I think the training, the dental, all of those great things, as well as the charitable giving, and it's just so many, so many things. So we just so appreciate all that they do in the community. Thank you. Thanks for joining us.
Appreciate it.
Still to come on Cox Connections, the state of the arts in the Roanoke Valley. We'll hear from the new director of the Arts Council of the Blue Ridge.